Hello everyone. Today we will be discussing about exanthematous fever and measles in particular. So as you all know, fever is increase in body temperature. Okay. So in case of children, that is any increase in body temperature beyond 36.7 degrees Celsius, usually taken in rectum in case of children less than 6 months. In case of children between 6 months to 3 years, we will take it in axilla, and depending upon the maturity of the children, beyond that we can take either in oral or axilla. Okay, now coming to exanthematous. So what do you mean by exanthematous? So exanthematous is a type of rash. So what do you mean by rash? So rash, we generally tend to call something as a rash when there is a change of skin. Okay, so change of skin in terms of color, appearance and texture. So this is what we call it as rash. Okay, so what is an exanthematous fever? It is an acute febrile illness accompanied by generalized rash. So now comes the question, what is an exanthem and what is an enanthem? So any rash that appears in outer skin is called as exanthem. Any rash that appears in the mucosa is called as enanthem. Okay, coming to the pathogenesis. Usually there will be a viral replication associated with immune mediated vascular reaction or toxin mediated reaction. So this is what actually causes rash in the skin or mucosa, which we will call it as exanthem or enanthem. Then this is usually common in pediatric age group because they are highly susceptible. So this is an example of exanthematous rash where you can find reddish discoloration of skin. Okay, so that is why we call it as rash. Okay, now this is a maculopapular rash. So what is a maculopapular rash? Type of rash that is actually flat red area followed by small confluent bumps. Okay, so there will be small confluent bumps just as you see here in the images. Okay, this is called as macular papular rash and this is typically seen in measles. Okay, so this is the difference between exanthem and enanthem, which we have already discussed. Okay, so exanthem, it will be a symmetrical rash that appears on the skin during the course of febrile illness, whereas enanthem is an eruption or spots appearing in mucosal membrane like oral mucosa or conjunctiva or genital area. And this is an example of enanthematous rash. So this is what we call it as Koplik spot, and this is also typically characteristic of measles, which is appearing in the buccal mucosa. Now, what are all the common exanthematous fever? Usually measles, rubella, varicella, erythema infectiosum, roseella, scarlet fever and dengue fever. So these are all the fevers in which there will be exanthematous. That means there will be a rash. In case of measles, it will be maculopapular rash, and in other diseases the rash will be of a different type and it will be present in different anatomical site. Okay, now coming to measles. Measles is a very highly contagious viral illness caused by morbivirus, and it is historically a major cause of childhood mortality ranging from 30% to 60% case fatality rate. Okay, and it is usually transmitted via droplet infection and airborne spread, and there is a history behind this measles that the red Indians who are the initial inhabitants of the north present day United States of America were almost wiped out because of this measles infection brought by Europeans. Okay, so measles has caused such a kind of agony to civilizations across centuries. Even in India, in Andaman and Nicobar Islands, there was a great measles outbreak brought out by the British in the 1850s, which has been recorded. So coming to the infection, there will be 4 days before. The infectious part will be 4 days before and 4 days after the appearance of rash. So this is the image of a typical child infected by measles, and this is the electron microscopy image of measles virus or morbivirus. And Causative agent, as we have already seen, this measles virus is caused by the genus morbivirus belonging to the family Paramyxoviridae, and it is an RNA virus which is single stranded, and it has a negative sense RNA which is enveloped. Okay, so it is transmitted, which is very highly contagious and spread via airborne route. So the characteristics are 3C: one, cough, coryza, and conjunctivitis with fever and malaise. So cough, coryza, and conjunctivitis. So the measles virus enters through, usually the pathophysiology will involve, virus enters through the respiratory epithelium and spreads to local lymph nodes, causes primary viremia, and then disseminates via blood, secondary viremia, to skin, conjunctiva, and respiratory tract. So the rash appears as a result of immune response to infected capillary endothelial cells. So this is why the rash appears. Okay. Now the clinical stages, it consists of 3 stages: prodromal stage, exanthematous stage, and convalescent stage. So this prodromal stage is the most infectious stage. So here there will be fever, cough, coryza, and conjunctivitis. Then there will be the typical pathognomic Koplik spot which you have seen earlier. In case of exanthematous stage, there will be a maculopapular rash which we have seen earlier, which will start with the face, trunk, and limbs. And the rash is confluent, which will fade with desquamation. And in the convalescent stage, the rash fades, but the cough persists. Okay. Now coming to the diagnosis, most of the measles diagnosis will be clinical, wherein Koplik spot is typical of diagnosis, and the laboratory diagnosis can be done in case of wherein IgM antibodies will be picked up by the RT-PCR. As far as treatment is concerned, there is only supportive care is available with fluids, nutrition, and paracetamol. Vitamin A supplementation is helpful, and there is a codependence with regard to measles and vitamin A deficiency. So measles causes vitamin A deficiency, and vitamin A deficiency again causes measles. So there is a codependence. So vitamin A supplementation can help in mitigating measles infection, and antibiotics is indicated only for secondary infection. Now coming to the complications of measles, pneumonia is the most common complication, followed by otitis media, which is laryngotracheobronchiolitis, diarrhea and malnutrition, and keratoconjunctivitis. This is again associated with vitamin A deficiency. The acute encephalitis and SSPE, this is the most serious complication that is present in measles, which occurs in 0.5% of measles case, and once the person reaches this stage, the death is inevitable. And this is the X-ray appearance of the measles, wherein you will be able to find out pneumonia, revealing thickened and blurry pulmonary markings, patchy areas of consolidations, and there will be enlarged hilar shadows. Okay, so this will be the findings in X-ray. So the findings will be thickened plus blurry pulmonary markings, patchy consolidated areas, then hilar shadows, enlarged hilar shadows. Then the prevention include live attenuated vaccine, wherein the first dose will be between 9 to 12 months, the second dose will be between 16 to 24 months, and it is given in the national immunization schedule, and it is given as MR vaccine, which is delivered through subcutaneous route, and in the private sector it is given as MMR or MMRV vaccine, where this extra M will be mumps vaccine and this will be varicella vaccine. Okay, so this is available in the private sector, whereas in government sector we give MR vaccine. In case of active infection, we can give passive immunization with immunoglobulin in high risk groups such as severe immunodeficiency or any HIV cases, or in case of isolation of cases and outbreak surveillance can also be helpful. So public health goal is we intend to eliminate measles through rigorous vaccination. So comparison with the other type of exanthematous fever, in case of measles you will find maculopapular rash and Koplik spot. Rubeola, there will be pink rash with lymphadenopathy. In varicella there will be vesicles in crops and lesions at various stages. And then in erythema infectiosum there will be slapped cheek, which is also called as slapped cheek syndrome. In Rosella infectiosum, rash will appear only after the fever subsides. Scarlet fever, there will be sandpaper rash and strawberry tongue. And in case of dengue, there will be islands of white in red sea rash. This is usually happening due to platelet deficiency. So to summarize, measles is an exanthematous fever. It is a negative sense RNA virus, and there are three C's, that is cough, conjunctivitis and coryza, and highly contagious in nature. Prevention includes vaccination, which is live attenuated vaccine. There is no specific retroviral therapy, and vitamin A supplementation and supportive care are for treatment purpose. So this is all about exanthematous fever and measles. Hope you have learnt about this conditions. Thank you all.